In Richmond.
In the city of Richmond, the number of confirmed cases of Legionnaires Disease grew once again today. State health officials added to the list the names of 2 more workers at the Richmond Social Security Building, bringing the total number of confirmed cases there to 9. Additionally, there are now 4 probable cases. Of those known to have had the disease, most have recovered, but 1 woman died. And as Eric Green reports tonight, another is fighting for her life.
Among the workers at Richmond's Social Security Building to be confirmed as having Legionnaires' disease, 1 is in critical condition. That's 48-year-old Margaret Thomas, whose name was added to the list today. A wife and mother of 4, she was admitted to Brookside Hospital on September 7th with pneumonia, but doctors suspected Legionnaires.
She came in confused. It was hard to know initially if it was due to the fact that her oxygen was low in her bloodstream.
A battery of tests, including a spinal tap, were performed. And late last night, the test confirmed Legionnaires' disease. Thomas is in a coma, breathing with the help of a respirator. Dr. Oster says what's causing the biggest problem now is encephalitis, a swelling of the brain.
She does move her arms, but she's not responsive to commands or anything along that line.
For the 6th straight day, the Social Security Building in Richmond remained closed today, and the cleanup effort there continued. Officials are concentrating on the ventilating system cooling towers, the suspected source of the bacteria. Also today, the president of a federal employees union called for a congressional investigation into the Legionnaires' disease outbreak, saying of the workers, quote, "We've got to protect them now, period." Dr. Oster says while Mrs. Thomas's pneumonia is improving, it's not certain whether she'll be able to survive the fight with Legionnaires. If she does, the doctor says it's tough to predict how well Mrs. Thomas will be able to function because of possible brain damage from the encephalitis. In Richmond, Eric Green for the 10 o'clock news.
And the problems in Richmond have prompted Social Security officials to begin a health investigation at their office building in Chicago. That building was built at the same time as the one in Richmond. It has the same kind of heating and cooling systems. The union that represents social workers in Chicago says the building's lack of proper ventilation is responsible for a history of chronic respiratory and other health complaints. OSHA investigators in Chicago say so far they've found no evidence of Legionnaires' disease, but they say they won't give the building a clean bill of health until they're absolutely sure. Social Security employees continue to work in that building while the investigation continues.